dosages based on body weight. So for any problem, you want to start off by reading the question. So the physician orders morphine sulfate at 1.8 milligrams IM stat. So right away, I already know that morphine is an analgesic classification of drug used for sickle cell, post-surgery, or chemo, pain. So it's IM, so I know that's more invasive than PO. So the child probably needs some pain medication immediately. So the child weighs 79 pounds, and most children's medications, they're all high alert. So we gotta be careful with the weight and weigh them daily to make sure that's safe. So we gotta calculate that. So from a reputable drug source, it's gonna give us the IM and subcutaneous dosage to be safe at 0.05 milligrams per kilogram. So we know that there's a problem because the weight's given in pounds, but the resource is giving it to us in kilograms. So we gotta first convert the pounds to kilograms. So I know that the child's 79 pounds, and approximately in my head, I'm doing that in kilograms. It's going to be approximately half of 79. So 80 is going to be around 40-ish kilograms. So make sure I'm converting it the right way. So I'm going to plot that into my calculator, 79 divided by 2.2. So if you don't remember, that is a conversion. So 1 kilograms equals to 2.2 pounds. So I'm going to divide that by 2.2. It's going to give me 35.9 kilograms. So I'm going to move on to the next step, which is going to be calculating to see if it's safe. So the drug resource gave us 0.05 milligrams times 35.9, and I'm sure to not round it until I'm done the problem at the end. So I'm going to keep it in the 10th place. So 35.9 times 0.05. So that's going to give me 1.79 milligrams per dose. Okay. So then now I'm going to round that to 1.8. And I'm going to compare that to the doctor's order. So looking at the doctor's order and what I have with the calculation, it is safety of. So now I can move on again. So moving to the next step, I'm going to now figure out how much to give. So I can look at the supply. So what we have in the medroom, how much to drop. So the supply is 5 milligrams per milliliters. I'm going to use ratio proportion, but you can feel free to use any method that works for you. So the doctor ordered 1.8 milligrams over X. I'm going to solve for X. And in the supply, I have 5 milligrams over 1 mil. Okay. So I'm going to cross multiply all that good stuff. So 5 milligrams X equals to 1.8 milligrams times 1 mil. So it's 1.8 milligrams per mil. Now I'm going to cross out the milligrams because I want to solve for milliliters. So next, I'm going to write out 5x equals to 1.8 milliliters. So I want to isolate for x. So I'm going to divide those sides by 5. So x is going to give me x equals 0.36 milliliters. So realistically, you're going to now, in the supply room, figure out which appropriate syringe to use. So here, I just wanted to show an example of a 1 ml syringe, and I'm going to zoom in a second to show you where the line would be at to drop 0.36 milliliters. Here you go.